Good morning and happy Friday. Thank you so much for joining us for our AOF's rundown of the changes that we saw in the Senate's first version of their budget that they put forth. We saw this released on Tuesday, and we've been digging through it ever since. I will say, at least from AOF's perspective, in terms of health and human services, we saw a lot of ground lost in investments really across the sector. Making sure that folks, again, have basic needs, work supports, that our kids are taken care of, fed, healthy. And certainly we know that a lot of our organizations here around the table today and are going to present on their priorities, really what they're doing to see some changes and maybe get some of that ground that we won from the governor and the House back into the budget at the end of it. Also wanted to make sure that we know that this certainly is not the end of the process. We know that the Senate is going to be having a second round of changes released next week on Tuesday. We do expect Senate Finance Committee to vote on their version of the budget on Wednesday, June 14th. And then we expect a full vote on the budget by the Senate on Thursday, the 15th. So there was lots of time for changes, for conversations. Also, if you are in the advocacy space and in contact with your elected officials and decision makers, certainly encourage you as well to begin conversations with members of the House Conference Committee. We would anticipate those members to be Representative Edwards, he's the chair of the Finance Committee, and Vice Chair LaRae, as well as Ranking Member Sweeney, in conversations for conference committee, as well as members of the administration. We know that after the Senate passes their budget, they will have a few weeks, really a week and almost 2 full weeks to discuss changes and align their budget so that they can send to the governor for signature by the end of this month on June 30th. So certainly really a sprint through the end of this process. Is going to be very, very involved. But I am excited to be, again, in partnership with our AOF partners here at the table today to tell you about what's happening, all the good work and advocacy they continue to do. The fight is still continuing, folks. So without any further ado, I'm excited and pleased to introduce our first speaker. We have Joree Novotny from the Ohio Association of Foodbanks to share some changes we saw in food assistance and eligibility for SNAP. So Joree, please take it away whenever you're ready.
Thank you, Kelsey. Thank you, Advocates for Ohio's Future, and Sarah for having me here to talk about why the current Senate budget, as introduced at this point by Finance Committee, would directly increase hunger and food hardship. And at the outset, I just want to reinforce, and I will say this over and over again in my time with you today, that we are in coalition with the speakers you're going to hear today and many, many others who have widespread, overarching concerns about many, many places, as Kelsey stated, where we've lost ground, significant ground in the Senate budget as compared to the executive and House budgets, and particularly the House budget. So we know that food is merely a symptom of poverty, systemic inequality, racism, all of the wage inequity and pulling apart of our economic strata that we've seen over years. So all of that plays into food security for families. I'm going to focus on food security and nutrition assistance in my remarks, of course, but just know that those are, of course, directly linked with so many other issues. So go ahead, next slide. I just want to really quickly ground us in where people are at, what Ohioans are experiencing, and why this budget is so very critical as we try to support people in recovery and getting back to some semblance of normal. Because I think some folks, maybe our friends in the Senate, have convinced themselves that things are normal, and they are very far from normal. So just to reiterate that we have seen months over months of very high inflation, very high increases to consumer prices, especially costs for food, housing, utilities, gas, those critical, household expenses that people have and that they're struggling to keep up with. We have not seen wages keep up. And of course, there are many households that don't have earned wages coming in that also can't keep up with the month over month pressure on their household budgets. In addition to that, with the end of the public health emergency, we saw the loss of at least and likely more than $126 million per month in federally funded SNAP benefits that about 1.5 million food insecure Ohioans were receiving for 3 years. So we knew that that was coming. And when that was approaching, before it approached, the last payment of those SNAP emergency allotments happened at the end of February. We had already seen quarter after quarter of record demand on our emergency hunger relief network. I want to state that we did see some lessening of demand, especially in families with children in the latter half of 2021, when the advanced expanded child tax credits were in place and some families had some resources to give themselves a little bit of breathing room. But when those advanced expanded child tax credits ended, and as we saw 2022 continue to inflate household expenses beyond what their wages and income and earnings could support, we were terrified of what was to come, and now it is here, and it is, just as bad as we anticipated for the millions of Ohioans that are living on the margins right now. So with that in mind, we surveyed from April 14th to May 7th. We surveyed more than 2,000 food bank clients from about a third of all of the zip codes across Ohio, anonymously, to ask them about what they're experiencing and how those changes and that pressure has impacted their food security and their economic security. Next slide. So this is why I want to ground us in the fact that food security is not, in and of itself, an outlying kind of thing that families can just well, I'm going to get my food and I'm good. We all know that, but just to reiterate, look at the choices that people are being forced to make. More than 2/3 of Ohio food bank clients had to choose between either paying for the food they needed or the gas they needed to put in the car to get to work, or to take their child to their medical appointment, or to their child care facility. 2/3 of food bank clients in the last 2 to 3 months had to choose between paying for food or paying for utilities. And now we know that utility prices are going up even more. More than half had to choose between paying for food or the medicine or healthcare that they needed. And half had to choose between food and housing. So this is an unacceptable dynamic. We cannot, no one can function this way month over month. And that's why we need to see a strong budget that invests in health and human services across the board. Next slide. I want to just, this is a really troubling, something that, has brought me to tears as I've considered the reality that so many people are facing. 2 in 3 households that we are serving in our network have adults that have cut the size of meals or skipped meals over the past year because there wasn't enough money for food. And more than a third did so almost every month over the last year. This is unacceptable. We cannot accept this in this great state and in our great nation, period. Next slide. So more than 8 in 10 of the food bank clients that we serve are reporting that one of the reasons they're seeking help with emergency food is because food costs are so high and putting so much pressure on their budgets. And more than half reported feeling down, depressed, or hopeless since March. We have to do better by our families, our households, our older adults, our disabled Ohioans, and our friends and neighbors. Next slide. I want to particularly point out that a few years ago, the data that we had showed us that about 50% of the food bank clients that we served earned slightly too much to qualify for SNAP. The most recent Feeding America Map, the meal gap data, as well as our statewide representative survey, shows that now it's only about 40% of Ohioans are poor enough to qualify for SNAP because we have such a low initial eligibility threshold for SNAP at 130% of the federal poverty level. But we surveyed these clients and they told us about how when those pandemic era SNAP emergency allotments were available, 3 in 10 of them said their benefits lasted the full month. For some of our older adults and people with disabilities, for the first time, they had enough help with their food budgets coming in through SNAP that they could get through the month and make some healthier choices, manage their chronic diseases by purchasing the fresh fruits and vegetables, lean proteins, and whole grains that they needed. But since those pandemic era SNAP benefits ended, that is not the case any longer. Just 5% of SNAP participants said their benefits lasted the full month. And the majority, about 3 in 4, said that their benefits were all spent within the first 2 weeks or less of the month. Next slide. Finally, I just wanted to share that we asked them what our clients, if they expect to rely on us about the same, more or less often in the next 2 months. 37% said they will rely on us more often in the next 2 months, and just 5% said they expected to rely on us less often. So we're reckoning with, a system that is strained beyond what we have ever been asked to provide support for, and looking around wondering how we are going to keep up, how we're going to keep people food secure. Next slide. So that is why I'm grounding us in that, so that you can understand why we're so desperately concerned about the Senate Finance Committee's proposed budget. It just does not align with the reality that Ohioans are facing right now. So instead of investing in access to food and basic needs to support and stabilize kids, parents, caregivers, workers, job seekers, disabled Ohioans, and older Ohioans, the Senate budget instead, next slide, eliminates the $15 million in additional funding to support our emergency hunger relief programs that was included by the House in its budget. Next slide. Eliminates funding that was included in the House in its budget to offset the cost of reduced price school meals for Ohio's K-12 students, which would provide more access to free school meals for more of Ohio's kids. Next slide. Proposes a long list of harmful changes and cuts to SNAP that would severely reduce, limit, and weaken eligibility for and access to federal food assistance. I don't have the time today to go into all of the egregious proposals on SNAP, but I will highlight a few that you've heard us talk about before that we have in one form or another rejected before, and that we need to stand firmly against again. One of those is an expansion of work reporting requirements and work requirements to include, so currently those apply to 18 to 49-year-olds in Ohio. This would expand that to include 16 to 59-year-olds in Ohio. This provision alone would be the most extreme of its kind in the country and risks taking SNAP away from approximately 385,000 needy Ohioans, including 170,000 children. The proposal would also reimpose a SNAP asset test by eliminating SNAP categorical eligibility, meaning that, for example, the asset test is $2,250 for most households. If you have an old beater that you're keeping going so that you can get to work, that's going to put you over the asset limit. Completely unacceptable and anti-worker. Another one I wanted to mention is that the proposal would ban the executive branch's ability from ever seeking a waiver on the SNAP time limit that currently exists, regardless of economic conditions. This was on the table just months before the COVID pandemic hit. I can't imagine where we would be if this were in regs and in law in our state. SNAP is designed to respond quickly to economic pressure and crises, both individual and community and state level, and we can't take away the ability to respond in those situations. So those are just a few of the many concerning provisions on SNAP that have been included. Next slide. So we urge the Ohio Senate to fully fund Ohio statewide hunger relief network. Our request is $50 million per year, instead of what the Senate budget includes, which is flat funding. And as we know, that's functionally a cut, a major cut, not only because of high food prices and inflation, but also because of sustained record demand that we need help to keep up with. Next. We also urge the Senate to remove the SNAP provisions in this budget that are harmful, misinformed, costly, burdensome, and unnecessary. We need every dollar of federal food assistance we can get to help people keep fed and help keep our grocery stores and our economy moving. Next slide. And finally, we urge the Ohio Senate to reinsert funding to offset the cost of reduced price meals to get more students connected to free meals in the school building to support their learning and their growth. Next slide. That's of course not all that we support. Those are the nutrition provisions that I wanted to highlight today. Please feel free to scan the QR code or visit the URL here to join us in our call to action on the Senate. And we join with our partners on the call as well in joining in theirs. And with that, I'll turn it over to Kelsey.
Joree, thank you so much for that overview. Of course, lots to cover. Even 10 minutes certainly isn't enough to share everything happening in nutrition. Another sector that has lots of changes and certainly can use your help and support is housing. So we are very excited to introduce Amy Riegel with Ohio to tell us what's happening with the Senate budget and housing. Amy, take it away when you're ready.
Yes, thank you, Kelsey. Hi, everyone. I'm Amy Riegel, and I'm the Executive Director at the Coalition on Homelessness and Housing in Ohio, otherwise COHIO. And we are an organization that's mission is to help to promote high quality, affordable housing for all within the state and to end homelessness. And so we do that activity in a number of ways that you can see here on the screen, everywhere from helping with the homeless system, doing training and capacity building, helping to promote democracy activity across the state, linking individuals with disabilities to income assistance, many different areas. And today what we're going to talk about is a lot of the advocacy work that we do in relationship to affordable housing in the state of Ohio. Next slide, please. So I will start by saying, similar to the other speakers, one, we are here to be an ally in all the efforts of improving the health and human services funding across the state of Ohio. We do not believe that this should be a zero-sum game, that for one of us to win, that anyone else should have to lose. We believe that these are all elements that are essential to individuals across Ohio, and that the need is becoming more dire every day. And so making any reductions at this time is unacceptable if we really want to be a state where people can thrive and prosper. And I'm usually the one who's fairly conservative in our messaging and in the way we present things. I want to make sure we're always presenting the information in a very balanced way, in a way that does not overstate the current situation. And so I'm often the one who's kind of softening things up. And being that person, I can say that this budget that was approved by the Senate Finance Committee is an all-out assault on rental housing in the state of Ohio. And not even affordable rental housing. It is an all-out assault on all rental housing in the state of Ohio. And the actions that they have taken are unbelievably out of touch with the needs of the community and of the realities of the state that we live in. And so I'm going to highlight some of those provisions today. Like before, I can't go through all of them because there are so many, but if you do have interest, please reach out and we'd be happy to go in deeper. But because sometimes housing can be somewhat nuanced and can not sound so bad, I definitely wanted to highlight a few to make sure that the why this has such a big impact is translated to everyone. So the first one I will highlight, if you could go back one slide, sorry. The first one I want to highlight is a program called Healthy Beginnings at Home, or HBAH. Healthy Beginnings at Home is a research study that looks at the link between housing stability and healthy birth outcomes. It is a study that is being replicated based upon the success of a feasibility study that was conducted between 2018 and 2020. The results were so promising that replication was highly encouraged. And we have had the support not only in the state of Ohio from the Ohio Department of Health, Ohio Department of Medicaid, the governor's office, and many other state agencies, but also encouragement at the federal level from CMS, HHS, HUD, and even the White House to continue this work. It is truly a one-time spend of funds to complete this replication that would bring the study to statistical significance. So if we do this project, then in the end, we will have enough data to show if safe, stable housing has an impact on babies being born full-term, healthy birth weight, and still thriving at their first birthday. In addition to that, we'll be looking at what are the Medicaid savings from those babies being born healthy and being able to have good preventative care and not acute care during that first year of life. The initial feasibility study had shown that those babies would be more likely to be born full-term healthy birth weight, less likely to use the NICU, less likely to have hospitalizations during the first year of their life, and to save significant money for Medicaid, for not just the baby, not just the mom in the study, but for everyone in the household. So this is a study that would truly transform the way that we approach housing stability during pregnancy. And this is exactly what our state legislature and the administration are always asking for. One-time spends that can prove and can create a model for how we can do this with funds that already exist in the future. This was exactly what they asked for. And the Senate took the $16 million budget that had been approved by not only the governor, but by the House, and reduced it to $3 million. Basically rendering the research useless and unable to move forward. And it would make it a program that has to operate year over year, not a one-time spend that creates a model. So we are asking for this funding to be restored, and we are working with many leaders from across the state, in the Senate, in the House, and in the administration to ensure that this program is restored. Next slide, please. So the other big items, as I once again say, there are so many of them, I can't go through them all, but I want to kind of highlight three big buckets. One bucket is that in the state of Ohio, we are experiencing significant economic opportunity and economic growth. In order for that growth to truly be successful and for everyone within the state to benefit from that growth, we need to have the adequate amount of affordable housing. And studies currently show that not only do we not have enough affordable housing across the state, but we're actually declining. Our deficit of affordable housing is growing. In a study that was released in March of this year, it showed that we have a deficit of 270,000 units across the state of Ohio to help house individuals who are extremely low income. That was a 6% increase from the year before. So we are 6% less units available today than we had a year ago. What we also saw is that for individuals who are extremely low income, that nearly 70% of them are severe rent burden, which means that they're paying more than 50% of their income on housing. As the kind of saying goes, is that the rent eats first. And to the comments earlier by the Foodbank Association, if you're paying that much in rent, you can't afford groceries. You can't make that little gap or that big gap to get to the end of the month with food assistance. And it creates a crisis within the home of being able to have those basic necessities that people need to thrive. So the House and the administration had both proposed a state housing tax credit. The state housing tax credit is a public-private partnership that would build additional housing units in the state of Ohio, very similar to the current federal low-income housing tax credit program, which is the most successful affordable housing development program in the nation. And so removing this from the budget means that not only will those units not be built, but we will continue to lose units across the state of Ohio, and we will jeopardize the hard work that our economic development partners have put in over the years to bring economic opportunity to the state. We will put Ohio in a position where the growth is not possible because we don't have the people to live and live in the communities, and that the people are struggling so much that economic vitality is not even an option for them because they're making survival choices day in and day out. So we are asking the Senate to restore this to the House version, which would be $500 million state housing tax credit. The other element is there are many different proposals in the budget that deal with how affordable housing is built and kind of the tax incentives that they can receive. So those can be stacking, if you will, different forms of credits together, like a historic tax credit with other federal funds like home or CDBG or USDA rural resources or even an energy tax credit. Oftentimes, when you're revitalizing an old downtown or a main street, these are often brought together so we can maintain historic, beautiful historic buildings that are kind of the cornerstone of our communities. They restrict this completely, not allowing the state housing tax credit to be the state historic tax credit, excuse me, to be twinned or stacked with any other federal resource if you're building rental housing. It's a specific direct attack on rental housing in this. They also limit being able to use a CRA credit or a TIF. These are all just ways that help communities to finance the building of rental housing, whether it be market rate or affordable housing, to bring downtowns and main streets back to life. They are stripping communities of the ability to do this. The last one I want to highlight is one that can be really hard for people to kind of wrap their minds around. And that is that in the proposal, they propose that there be an Office of Housing Transformation under the Ohio Department of Development. It would be a director level position appointed by the governor with a direct cabinet seat. We appreciate their concept of offering more of a voice on housing at the cabinet level and to have that direct voice at the table. However, in doing this, they abolish the Ohio Housing Finance Agency and they strip the agency as it moves into this Office of Housing Transformation of all of the abilities to conduct the business that OFA currently conducts, including issuing bonds, being able to audit and monitor projects, and to be able to make decisions of how and where funding is allocated based upon best practices in not only the housing development, but also within the financing. Where this has a huge impact is that the work that the Ohio Housing Finance Agency does is a public-private partnership. It runs on the fact that private companies are going to make investment choices to invest their dollars, their tax credits, in housing in Ohio. And they decide how much that investment is worth based upon the risk that they are taking in making that investment. So the more stable, the more consistent, the more transparent you can make the program, the more likely that the investors are going to pay more for that tax credit. So for $1 tax credit, they will pay 92 cents. And if you make it more risky, less consistent, political, or have any type of risk involved in it, that tax value becomes less. So they only pay 70 cents on the dollar for a tax credit. I am a liberal arts, or was a liberal arts major, so I don't try to do math in public, but I'll just use it this way. That means that if we have $100 million of tax credits, that currently we're receiving a value of about $920 million, or I'm sorry, 92, this is why I don't do math in public, $92 million in value for those tax credits. Every 10 cents that goes down, that equals 10 projects that can't be done in the state of Ohio because of the value we lose. So this means every project is 40 to 100 units. So every single 10 cents that we lose, we're losing anywhere between 400 to 1,000 units of housing. This would be detrimental, and it sets the office up to be a failure and a worst practice in the state of Ohio on how to administer a program, as I said, that's been proven to be a national benchmark of being able to develop affordable housing across the country. Next slide, please. You'll just see more of these different elements. Like I said, you'll receive these slides in this recording. If you have any questions, please reach out. And lastly, why this is so important, why this is why they're so out of touch. If you could flip one more slide, you'll see that rent continues to skyrocket. If we look at where we were in 2019 to today, we're seeing almost a 25% increase. And though that is stabling out a little bit, you'll see that tail end of Q1 of 2023, it's actually it went down and it's ticking back up again. So we're still not stabilized. It's still going up, and we're still feeling this across the state. And last slide, and where we start to see that immediately is in the eviction filings. Most major cities are back at pre-pandemic levels, and everyone is kind of teetering right there to pre-pandemic levels. So we're seeing eviction increase. Many cities across the state have released their point in time counts of homelessness across the state of Ohio, and we see those numbers skyrocketing too. All the data tells us that the situation is getting more dire, and yet our Senate chose to make decisions that will intentionally hurt Ohioans across the board. And so what we ask is very simple, is that the budget be restored to the House approved package for housing elements, and that is the simple request we are making in conference committee, is that the House proposal be restored. So thank you very much. And as I said, here's our contact information. Please feel free to reach out to Gina or I if you have any questions.
Amy, thank you so much for covering everything that's happening, man, in the Senate slide. We do have a number of questions in the Q&A. We're going to return to those at the end of our presentation today. And thank you for keeping those questions coming. I know our advocates are eager to answer and give you some more information. So moving forward to our next speaker, we are excited to have Elizabeth Hess from Groundwork, Ohio, here to talk to us about maternal and child health issues, as well as childcare in the budget. So Elizabeth, when you're ready, take it away.
Great. Thanks, Kelsey. Go ahead and you can use some QR codes that we have in these slides, but we did want to share that we've got some content coming out on our website on our reaction to the Senate budget. Please feel free to take a look at that, share those out. As you can tell, we are pretty disappointed in the Senate's proposed budget. I'm going to go ahead and put this link in the chat as well. If you go to our homepage, you can take action and send a note to your legislator. You can send this out to your partners. We'd appreciate that. As of last night, we had hundreds already going out to both Senate and House representatives. You can go to next slide. So I'm going to start with early learning. We've experienced some pretty devastating cuts, and not just cuts in investments, but policy changes that have been proposed that would be pretty detrimental to young children and their families. What we saw come out in the Senate's proposed version of the budget was an expansion to a step up to quality exemption that got started in House Bill 45 in December, that would expand exemptions to step up rating requirements to centers serving less than 50% capacity publicly funded childcare. This really doesn't solve any of our problems and is a huge problem for our providers who are trying to stay open. As many of you know, our reimbursement rates in Ohio are abysmally low, and this would create further issues if our centers chose not to participate in Step Up and have access to those higher rates and higher quality. We also saw a prohibition of Step Up to quality rating systems from even considering highly trained staff as part of the requirements of its tiered rating system. This would continue to deprofessionalize an already challenged workforce, and we, of course, are not in support of that prohibition. We are really disappointed to see that the Senate is only proposing to extend eligibility to publicly funded childcare to 145% of the federal poverty level. This is simply a 3% raise. It would do almost nothing for our families, and it's an effective $202 million cut over the biennium. The governor and the House both agreed on lifting this up to 160%, which would offer extension of these services to thousands of families across our state. We also saw a cut to the Quality Support Fund by $14 million over the biennium. We saw cuts to licensing funds, which puts our children's safety in jeopardy. We saw cuts to early intervention funding. We saw cuts to the House created Child Care Infrastructure Grant. That was a new grant meant to support building quality childcare services for infants and toddlers across our state in both Appalachian communities as well as communities with high infant mortality rates. In the Senate's proposed version, we see that cut in half and to only include Appalachian communities. So to exclude the communities with high infant mortality rates. The Senate did not restore the $150 million ARPA childcare scholarships that were proposed by the governor that we've been fighting for along the way, that were cut by the House. These scholarships are really important to our families who are in critical occupations, but are making less than 200% of the federal poverty level. We see such a workforce need in those areas. And the number one reason that folks aren't taking those jobs is because they don't have access to quality childcare. And this would help to alleviate that issue in the short term. And finally, we saw further cuts to the governor's proposal for increased investments in early childhood mental health consultants and consultation services. This is the only line item in the entire budget that is focused on early childhood mental health. And coming from the Senate's version, it's now sitting at only $3 million in fiscal year 24 and $4 million in 25. That is not nearly enough to meet the needs of the young children in our state. You can go to the next slide, please. So what remains in early learning investments? Not a whole lot, so we've been quite busy over the last few days. What we see remaining and that we are excited about is the governor's proposed public preschool expansion, though we are concerned about the quality of this programming being impacted by the step up to quality proposed provisions. We are disappointed to see the House increase in this expansion removed from the Senate's version of the budget, as that increase would pay for some piloting of full day services, which we know that families are in desperate need of. We still see the Department of Children and Youth, which our organization is supportive of, though the program funding has been decreased by nearly $167 million from the governor's proposal. So it's great to have this new agency, but only if this agency has fully funded programs. We also saw an increase, though, in lead abatement activities from the Senate, and we saw we saw that the Imagination Library funding was not impacted. You can go ahead to the next slide. So at Groundwork, we also focus on maternal and young child health, and some of these issues have been spoken about today, especially in the nutrition space. But here again, we see the cut to early intervention funding. We saw the cuts to the mental health space. We saw an elimination of the proposed infant health grants. There was also a reduction in the infant vitality grants by $1 million each year. We were really disappointed to see the Senate fail to restore the House cuts to the governor's proposed increase in Help Me Grow evidence-based home visiting. We already heard about Healthy Beginnings at Home, and we're right on board with that as well. Deeply disappointed by those cuts. Further, we were deeply disappointed by the elimination of the extension of Medicaid coverage to pregnant women and children, and also to adopted children. If you can go to the next slide. There's just this laundry list, right, of cuts that are really important to our young children and their families. I do want to skip right ahead to that last piece on the elimination of the earmarks. If you can go back to the slide before for TANF. Our organization is deeply disappointed in the messaging that's coming out of the Senate right now, that the TANF earmarks are being removed essentially because of childcare. That is ridiculous. There are ways to fund childcare and fund other programs for children and families. And so we are resentful of that messaging. And so we hope that you'll stand with us as well to say that this is not a zero-sum game, that you can have quality childcare for families living in poverty, and you can have these other supports and systems paid for as well. Next slide, please. So what remains in maternal and young child's health, again, we see the Department of Children and Youth, the lead abatement. We keep seeing the elimination of sales tax on critical infant supplies. That's very good for our families of young children. We see the benefit bridge employer pilot program and the paid parental leave for state employees. So please join Groundwork in reaching out to your legislator, sharing with your network our action alert. We tried to get a collective voice on this for young children and their families. And please let us know how we can partner with y'all in the future. Thanks.
Beth, thank you so much for sharing. Again, there's so much to cover, so many changes. And unfortunately, we wish we could have better news to share with you today, but look forward to, again, everyone on this call, your advocacy, and thank you for being part of this movement to make sure we have better policies and better investments than we're currently seeing from the Senate sub-bill. So next up, we are excited to welcome Steve Wagner from the Universal Healthcare Action Network, or UCAN Ohio, and he is joining us from his phone. So Steve, can you hear us?
Hi, Kelsey. You got me now?
We got you, Steve. You're ready. Coming in loud and clear.
Fantastic. Okay. So this is Steve Wagner from UCAN Ohio. We're an advocacy organization that believes everyone should have access to affordable, quality healthcare. And, as I think Joree started off, the well-being of a person isn't just one thing. It's food, it's housing, it's healthcare coverage, it's the ability to work at a job, but still have the ability for your kids to get an education, for there to be childcare. And so we believe and support all of these things that AOF is pushing. We believe, I think, as the governor has said, that this should be a place that families and children thrive. But instead, this is becoming a place where it's difficult for people to survive, difficult for children and families. And unfortunately, this Senate budget makes it even harder for children and families to survive. So, and I'm sorry, I think maybe Beth said it, but or others, the House version does some things that are important for families and children. There is opportunity for a budget that supports children and families, but the Senate version does not do that. So, for example, and I'll run through a number of these things that the Senate just took out, that in taking it out is harmful to families, or they put things in that are harmful to families. So they removed the raising the income level that's required to qualify for Medicaid for pregnant women and children. So, healthcare being so important for a pregnant woman, so they have a healthy birth. Our state has one of the largest problems with infant and maternal mortality and morbidity, and and having healthcare coverage is critical. And so that really needs to be back to what the House is. Another important thing that the House did was allow for continuous Medicaid coverage. So for a child qualifies for Medicaid, they don't have to go back and keep reasserting the parents don't have to keep reasserting their eligibility. They've got that health care coverage through the age of 3. The Senate took that out. Neonatal abstinence syndrome. There was some funding to help with the care of children with NAS. Senate again took that out. Doulas, having someone that can help a woman through pregnancy into where they're caring for their child, that is really critical for people to have. It improves the outcomes for mothers and children. The House added that. The Senate has taken that away. The Senate took away Medicaid in schools, so the ability to do something important in terms of assuring healthcare through the one place many of our children are going to, which is their schools. And then the harmful things that the Senate added in. They added in this threat on presumptive eligibility. So, you know, when it's so for example, with pregnant women or children, that there's the ability to very quickly say, you know, we think this child or this mother is going to qualify. We're going to, you know, put them into the Medicaid program as quickly as possible. We will sort out, you know, Medicaid will sort out later whether they're truly eligible, but let's give them their health care that they need in this moment. That's a simplification of presumptive eligibility. The Senate added in a provision that's trying to penalize those entities that are trying to get people in quickly into the program so that they can get their health care. This is really kind of a threatening kind of posture that's in the Senate's version. The other is something that we've seen before, which is these work reporting requirements. Work reporting requirements are nothing more than a way of throwing up administrative burdens to try and delay people or from getting Medicaid, or to drop them off because of procedural errors or otherwise. It does nothing to get people into work. It does nothing to get people healthy. The Senate added that as well. I do want to point out there are a few good things in this budget related to health. There is increases for direct care service providers, which is critical. I should point out that many direct care service providers, so those individuals who are going into the homes to help people remain independent when otherwise they would end up in a nursing facility, those individuals oftentimes are making Medicaid level wages. They qualify for the Medicaid program. That's the only place they can get their health care. It's important to raise their salary so that they can make a living wage. Second, this is kind of a sneaky piece. 2 years ago, the legislature started to get rid of what's called the healthcare assurance program. And that's a way for there to be coverage for individuals who wouldn't otherwise qualify for Medicaid, but need care in a hospital and are at less than the federal poverty limit. So, you know, really the ultra poor individuals, these are oftentimes new Americans, immigrants who wouldn't for some reason qualify for Medicaid, and it's trying to prevent them from ending up having massive medical debt because of a hospital bill. House and Senate both added in amendments that would allow this program to continue another 2 years. It actually needs to continue indefinitely. There needs to be that kind of safety net for those that aren't going to qualify for Medicaid. A positive, it's hard to say there are positive things from the Senate version, but there are actually two positive things from the Senate version. One is requiring that for Medicaid, the medical loss ratio is published. In super simple terms, it's about, the medical loss ratio is mostly about how much administratively and profit-wise the managed care company gets out of administering that Medicaid, you know, for the state of Ohio. That would be published out there. The other positive thing is the incorporation of House Bill 49, which is hospital price transparency. The Senate added that in. It basically codifies what's already required in federal, but it also then puts both some carrot and stick to getting hospitals to do that, because hospitals in Ohio are generally not in compliance with providing transparency on the price of their services. I guess I should also mention what didn't happen in neither the House or the Senate version, but I think is important from a public health perspective, is it did not allow the administration, is not allowing the administration to move forward with regulation of vaping and prohibition of flavored tobaccos, which are really a push into younger audiences to create nicotine addiction. So that was in neither House nor Senate. And I will leave it at that, Kelsey. Thank you.
Steve, thank you so much for sharing with us. Oh my gosh, again, lots of ground lost specifically in healthcare coverage for kids and families, pregnant women, my goodness. Again, hopefully we can continue to make progress and taking back some of what we gained from the governor and the House. So I'm excited next to introduce Mary Wachtel. She's going to talk to us, and Mary's from the Public Children's Services Association of Ohio. Welcome, Mary. She's going to talk to us about what's happening for kids and really what's going on. Man, again, lots of changes from governor and House. Mary, take it away whenever you're ready.
Sure. First of all, thank you for having me, and we appreciate our partnership with all of you and with the coalition. I think that the points and issues that have been raised already are all so relevant and kind of depressing. But when you look at it from a children's services lens, we know that families who struggle with the chronic stress of poverty and trying to make it by are at greater risk for at times that stress overtakes and can lead to not good situations for kids. So I would start by saying all of this compounded is very, very concerning, also from the children's services perspective. Next slide. I put a partial list on this because there's so many other things in the budget that impact children's services, but I'm giving you a pretty narrow lens of issues that members of my association have prioritized. And there are three things. We're very concerned about the cuts to the proposed increase in the KID line item that occurred both in the House and the Senate. And at this point, we're asking that it be restored to at least the House pass level. We continue to struggle with a treatment and placement crisis in Ohio that leads to too many kids having to spend a night or multiple nights in a children's services agency or staying in a hospital long past they should be in a hospital. And we're very concerned about some policy language. I will make a note right here that as we saw in House Bill 110, the administration continues to use the budget bill as a vehicle for moving significant policy proposals related to children's services. At least in House Bill 110, those were tethered to some of the recommendations in the Governor's Children's Services Transformation Report. We saw a number of policy proposals in House Bill 33 come forward from the administration without consultation or stakeholder input. And they're not tethered to existing recommendations. So that's why you see some of our work on the policy here. Go ahead, next slide, please. On the KID line item 830506, essentially, this is the transition of the existing ODJFS line item 600-523, Family and Children's Services, into the new department. What I have provided here is you can see the trajectory of the funding, current funding level at just about 218 million. Then the introduced version, which bumped that up quite a bit to 280 and 291. You can see the reduction in that proposal that the House Pass budget did, and then very concerningly, the further reduction. This is the largest line item in that new department, so it makes sense, right? That if you're looking to cut, you're going to look where the money is, but we're very concerned about the impact of this. The good news is that the language associated with this line item maintains these 4 earmarks that I've listed for you here. Most notably for us is the state child protection allocation, which is the only dedicated GRF that goes out to all county agencies. And that 145 and 155 million you see listed here represents an increase of 25 and then 35 million. So this level of funding would continue to put Ohio on the right trajectory to right size the proportion of state dollars that goes to fund child welfare. The challenge, though, because we've done the math, is all of those earmarks consume the bulk of this line item, and the balance after those 4 earmarks leaves, you can see 46.5 million, then 34 million. So the reality is there's no way that these earmarks can be expended to their fullest and without cutting a set of very important programs that are always also in this line. Next slide, please. So these are the non-earmarked programs that we are aware of also live in this line item. And most of these are existing investments and see some increases. A couple of them are new investments, most notably the line item to support Ohio's transition to a more robust tiered foster care program. Road to Success is also a new program that would assist foster youth in obtaining driver's ed and driver's education. And we've been in conversations with the Ohio Children's Alliance, who's the vendor for the Bridges program. And that 8 million that it's funded for is actually not sufficient for the program today and expansion. My point in showing you this is the challenge, right? So if you go back to the previous slide, the 230 million funding level that the Senate now has for this line item isn't enough to do all of these programs. So our ask, and you can go ahead, Sarah, our ask is that the line item 830506 be restored at least to the House levels. I was on a call with some of you recently, I forget which call, sorry, and I mentioned the Ohio START program. Ohio START is a statewide program that's right now in 54 counties. We have plans to expand it. I forget the exact number of counties in the next biennium. PCSAO manages this program. It is a program that's led by Children's Services agencies in partnership with local behavioral health and substance use providers, and it pairs a family peer mentor with a children's services caseworker to work with families who struggle with both substance use issues and child welfare issues. You can see that our total program budget, you can see in the top line there, the funding for this lives in 2 departments in OMAS, Continuum of Care line item 336421, and then also in the KID line item I just talked about. So we are very concerned that with the reduction in the KID line item and the need to make sure that items in the OMAS Continuum of Care line item are fully funded, we would extend that to, we really need to see Ohio START fully funded so this excellent program can continue. Next slide, please. This is an amendment. This is amendment language that we are seeking to get into the omnibus amendment. We had tried to get it into the sub-bill, weren't successful. We're not quite sure why. So we're going to try again. I think a number of you know that our agencies, other local systems and agencies struggle, that we don't have sufficient treatment for kids, especially with complex needs. And we certainly don't have sufficient placement options for them. Part of that obviously is due to the workforce challenge. We know that residential facilities aren't able to operate at 100% capacity because of workforce. But these are ongoing gaps that Ohio has had. We issued a placement crisis report in February of 2022 and asked for state level leadership and action. And frankly, there hasn't been a lot of progress. So this, we are partnering with 7 other statewide organizations. You can see them listed here. We're asking that state family and children first cabinet agencies work with these stakeholders and others, and that we focus on treatment and placement solutions for a particular population of kids, and that's those with developmental and or intellectual challenges and high acuity behaviors, which is a fancy way of saying essentially aggressive behaviors. Those are just kids who are hurting so much, have experienced so much trauma, and Ohio's got to do better for these kids. Next slide, please. So I will say on the policy side of this budget, to kind of just flesh out some of my opening comments, there were a number of policy proposals in the executive budget that we had concerns about. We had several conversations back and forth with ODJFS about could we work together to address some of these? Could you clarify some of them? And through that process, we whittled down our policy list to about 4. We did make some progress in the sub-bill. But this is a particularly concerning policy proposal. And that is that in the executive budget and maintained in the House, ODJFS inserted language that states that substantiated, so that means we found them to be true, dispositions of child abuse and neglect will be expunged from the statewide Automated Child Welfare Information System, SACWIS. We begged ODJFS to change that policy because the effect of that to expunge those types of records after 10 years from SACWIS is that there would be no record of them. So if we were to receive a call on, the same family, we wouldn't know the history. Employment checks that wouldn't show up. So ODJFS instead did seek and get an amendment in the sub-bill. And this sounds very technical, that but what they do is those records would now be expunged only from the part of SACWIS that runs background checks for people when they're applying for jobs in childcare in a residential facility. It still maintains the blanket expunction, and we think that's wrong. We've researched other states, and this isn't how other states handle expungement of these records. We agree Ohio should have an expungement policy. Some of this stuff dogs people too long and does impact their employment prospects. And we believe that people, there's rehabilitation but we just think, we know this is the wrong policy to have it be just a blanket expunction. So we have an amendment, again, that we weren't successful in the sub-bill, but we're trying again to get that language out and instead have ODJFS work with stakeholders to develop an expungement policy. I'm probably over my time. I'm sorry. I think that's it, right? Yeah. happy to take questions or deal with that at the end.
Mary, no, thank you. And we have plenty of time left. We are going all the way until noon. We have one more speaker. We have a couple questions. I do invite viewers and our speakers to keep an eye on the Q&A function. I know some of our speakers are responding to questions in there now. You're welcome to look at some of those Q&As that are already coming in. As we move on to our final speaker of the day, very excited to welcome Guillermo from Policy Matters Ohio. He's going to talk to us about all the tax bill changes. Again, we knew they were coming, and this is where we're at. So Guillermo, whenever you're ready, please go ahead and join in.
Thank you. Good morning. Can you hear me?
We can.
Thank you. Yes. Thank you everybody for having me, and also for the speakers who've already went to just highlight the kinds of critical needs that we have here in Ohio, the kinds of investment that we need in our communities and the long-term, foundations of the state. I think that I have the unfortunate responsibility of highlighting just how difficult it will be for us to make those critical investments in Ohio families, in Ohio's kids, Ohio's elders, Ohio's in basically the care structure of Ohio, because we are the foundations of the state, the fiscal foundations of the state are frankly under attack, as they've been under attack for many years. But this Senate budget bill proposes to land another blow on those foundations, another blow on those crumbling fiscal foundations, and it should be of a concern to all of us here on this call and throughout the state. Next slide. I tried to highlight a few of the most concerning tax changes proposed in the Senate budget bill. Over the next 2 years, the number of personal income tax brackets will be reduced to just 2 or 3 if you count the bracket that has a 0% rate. This will leave Ohio with just 2 rates, 2.75% on incomes over 26,000, 3.5% on incomes over 92,000. Just to give you a bit of context, currently we have 5 brackets from 2.765 to 3.99%. So this would cut taxes on everybody, income taxes on everybody. But as you'll soon see, the impact of that tax cut is not quite as widely shared as you might expect when you see those numbers. This in of itself, plus actually the next bullet point. So let me just say that first. Suspension. The next part is they're going to suspend the indexing of income tax brackets and exemptions for inflation. Now, what that means is that the thresholds at which you go from one income tax bracket to the next, usually they're adjusted to inflation, just to reflect the fact that prices change in the economy, and you want to make sure that people aren't being punished just for the simple fact that inflation is happening, right? So you adjust those brackets and you adjust the exemptions, the standard exemptions, to reflect the fact that the value of money changes over time, right? But starting fiscal year 23, they're going to suspend those inflation adjustments, and what that means is that everybody will see a small tax increase. Basically, everybody will see as the value of money goes up. On average, people will see, relative to that number of inflation, whatever it will be in the next coming years, that's how much your taxes will go up, basically. But it's particularly concerning for people who are on the threshold of not paying taxes and paying taxes, because they'll go from paying 0 taxes to paying some of these things are smoothed out by credits, but to paying like $300 to $400. So you'll see in a little bit that this actually means that a lot of people, especially lower to middle income people, will see an increase in taxes because of this bill, just temporarily. Because starting in fiscal year 25, what they want to do is use that additional money, this kind of, strange artificial way of increasing revenue by punishing people because of inflation. They're going to use that additional money to start reducing that tax cliff, basically reduce the amount that you pay. Even though the tax rate on incomes below 26,000 is zero, when you start paying taxes, you actually are paying a small percentage on that amount. So that's what creates that tax cliff. So they're going to use that amount to get rid of the tax cliff, which, I think we can all agree that there shouldn't be a tax cliff, but it's just odd to design it in this way where we're basically punishing people for inflation and affecting certain people more than others. So I'm still working on the numbers to see exactly how this will turn out. I have some rough estimates in this presentation, but hopefully in the coming days, we'll get some numbers from the Institute of Taxation and Economic Policy from their models, and we will continue to refine our own so that we can have some specific numbers on this. But for the time being, I reached out to LSC, and they still don't really have precise numbers on this because it starts affecting us in coming biennium. For the first two bullet points here, this is already $1 billion per year lost in fiscal revenue. So unless I'm wrong, I don't think anybody on this call advocated for a program that was $1 billion. We're talking, the biggest programs that we've been asking for are in the millions or hundreds of millions at most. And so it's to lose $1 billion worth of revenue every year from now into perpetuity. You can just imagine the kind of countless missed opportunities to really invest in families and communities across the state that are hurting most. So that's the personal income tax changes. I'll have a little bit more on that in a second. Another big impact here is over the next 2 years, a 25% reduction in the corporate activity tax, or CAT, on the rates and minimums. So this is $500 million lost in revenue to the state every year. And I'll show you in a little bit how unreasonable it is. Then there is, as somebody mentioned earlier this morning, or actually I guess that was the previous call, they're going to expand the sales tax. Any additional excess GRF is going to go into an expanded sales tax. Sales tax holidays are expanded sales tax holidays. Sales tax holidays are tricky to explain, right? Because it is true that for families, doing back to school purchases, this could be a benefit. But there's a range of issues. First of all, there is a longstanding suspicion that since everybody knows exactly when these things are happening, the stores that provide, that people go to buy at, the biggest stores in particular, don't decrease prices during this time. They might even increase prices to make up for the difference because they know that people are going to come out to buy in droves. Now, I don't have any data on that. So that's just a suspicion. Some people have published work on it, but it would be interesting to continue following it. The other issue, right, is that with these kinds of tax holidays, the people who benefit most are the people who purchase the most items, right? So the more you buy, the more you benefit. So as you can imagine, that means that the people who are struggling the most to buy things are the people are not going to be as benefited as others. There are better options. There are better options to reduce the sales tax on things. There are things like the sales tax credit, which would be targeted towards low-income families or families with children. There are ways to do this. The one silver lining in the Senate budget bill that I pulled out was that the Senate brought back the governor's proposed increase on sports gaming receipts. They increased the tax rate from 10% to 20%. This is a small sliver of revenue, but it is a growing economic sector, and it is very much worth ensuring that that kind of money goes back into families, schools, and communities. Next slide. So back to the personal income tax changes. So in the past 23 years, there's been 12 tax cuts. This would be the 13th. Every vertical bar there is every vertical line there is a personal income tax cut. As you can see, the green line, that's our state revenue. we've had pretty much stagnant state revenue since the turn of the century, right? It's nearly a quarter century. And when people refer to the kind of the potential of state tax increases receipts because of tax cuts, what they're referring to is that dashed gray line, which is not adjusted for inflation. I mean, this is like from a fiscal standpoint, adjusting for inflation should be pretty much a basic mathematical function. So whenever you hear that, just then, did you adjust for inflation on that? Because it doesn't seem like it. So this is critical for all of us, right? This is critical for the kinds of institutions, services, the things that we need for our family. And I know I don't have much time. So next slide. This is the impact. This is my rough draft. So please, this is just my first time putting together the numbers on the impact of the personal income tax change. As you can see, the bottom half of Ohio, so half of Ohio households make less than $62,000, either sees no income tax changes or actually an increase in income taxes, a small increase. From that point on, the savings, the tax cut grows and grows and grows. A family of earning, $1 million, a family of three would have tax savings near to $2,700, which isn't a huge amount, but it adds up because we're talking about $1 billion a year. But yeah, a family of 40,000 with income of 40,000 would see a tax increase. A family with $1 million of income would see a tax decrease of $2,700. This is some adjustment will have to be made to this graph as I refine the calculations. Next slide. This is critical because, as many of you know, in Ohio, the wealthier you are, the less taxes you pay as a share of your income. The green bars that you see there are the sales taxes, the excise taxes, all the types of taxes that we all pay equally. So if you wanted to make this a fairer system, if you wanted everybody to pay the same amount of their income in taxes, you would have to increase taxes on the wealthy such that they pay the same share of their income as the working class, low-income Ohioans. Next slide. Okay, this is the CAT tax changes. Sorry if I'm going too quick. What I'm trying to show here is that the corporate activity tax already, basically, small businesses already do not pay very much in CAT. Okay, so about 65% of small businesses of businesses that file gross receipts that pay the CAT are earning less than $1 million in revenue. That's 65%. What that means for those corporations is that they pay either the minimum CAT tax, the annual CAT tax, which is $150, or they pay zero. You pay zero CAT up to $150,000 in receipts, and then beyond that, from that to $1 million, you pay only $150. So when you cut the CAT by 25%, that is less than $30 of tax savings for 65% of corporations. On the other hand, we have 82 corporations that have receipts over $1 billion, right? So that's that lower bar. That's the low blue bar. What you see, the green bar is the number of filers. The blue bar is the share of the cut, right? So the value of the cut, I forget exactly the figure. I think it's 29%. No, maybe more like 25 or 26% of the cut will go to those 82 companies that earn over $1 billion per year. About 24% will go to those making between 100 million and 500 million, and then I think that's about 9% on those above that and between that and billion. So all that together, the vast majority of the tax savings go to a handful of corporations that are earning inordinate amounts of cash, that are making inordinate amounts of cash. The vast majority of corporations and small businesses in particular will get very, very little or nothing from this CAT tax. But it costs the state, it costs families, it costs communities $500 million. I think I might leave it at that. I had other slides that talked about the kinds of things that we would like to see. We would like to see a refundable EITC. We'd like to see a child tax credit. we would like to see an increase on corporate tax, the actual corporate income tax, the elimination of the LLC loophole, and taxation on very high incomes. But I think I'll leave the discussion of that for another time. Thank you all very much.
Ishay, thank you for that. And we certainly commend you for diving into those numbers that we just learned. Super deep analysis. I know that as Amy said earlier, I'm also not a math person. Try not to do it in public, but commend you for trying to get those numbers out and really making sure we know the impact and the difference between the House and Senate moving forward. So folks, we do have some time for questions here today, and I thank our speakers for your time and for sticking around with us for this time, as well as all of our viewers. We have a lot of folks still with us on the webinar. Thanks so much for being here. So I will actually toss it first to our participant, Steve Wagner, and we might have lost him. Oh, hi, Steve. Look at you. You're right there. So we have a question in the chat from one of our attendees. Says, well, it is good that there is no language included in the House or Senate versions, which would lead to a prohibition of flavored tobacco bans. Is there any conversation or legislation about a statewide flavored tobacco ban?
Yeah, if I said I didn't quite hear them saying good, it is not good that the House and the Senate did not include the governor's version. The governor's version has a prohibition of the sale of flavored tobacco products. So prohibits any person from giving away, selling, or otherwise distributing flavored tobacco products other than tobacco flavored tobacco products. So you couldn't have menthol, you couldn't have bubble gum, you couldn't have any of that crap that is, and that's a public health term. But you couldn't have any of that is appeals to that encourages people to take the consumption of the product. So that was all about the governor's language, trying to put in some ability to regulate those products, regulate the sale of it. And that goes not just for vaping, but it goes for cigarettes as well, with menthol or otherwise. And so, yeah, I mean, I think there's a little bit of intent by the state to do that. But right now, the House and Senate have not seen fit to include those provisions. And I don't know, Kelsey, did you include that in?
Oh, Steve, I'm sorry. We're losing you with your connection. We might come back to you. We'll come back to you in just a moment if that's okay. You're a little bit frozen. So folks, once again, a reminder, a lot of specific policy questions have been answered by our speakers in the Q&A, but wanted to pose a couple maybe bigger picture questions to our speakers and experts that we have on the line still. The first would be, we have some folks who are new to the state budget process, welcome, on the call, but they're new to following the state budget process. Is it normal for the Senate to severely reduce the House proposed budget? Or is this a symptom of the rise in wealth inequality and our policymakers ignoring the most vulnerable communities? Generally, I will say we have normally seen, at least in the past few budget cycles, a more conservative budget come from the Senate than the House. I will, from my assessment as myself, this is a little bit more extreme than we've seen in the past few General Assemblies, and then would welcome takes from our speakers on the call. You're welcome to unmute to show your face if you'd like, just kind of your general consensus of the overall themes that we're seeing from the Senate. Mary.
Yeah, sorry. Getting both the camera and the microphone working is a challenge today. Yeah, I agree with you. One of the lens I look at it as is, I don't know how much of the cuts are made in an intent to inflict harm versus to achieve the priority agenda that is the priority agenda for this set of legislators. So if your priority agenda is to do a bigger tax cut, if your priority agenda is to do universal school vouchers, you have to find a way to pay for that. So one way I think to look at it as like, is just that there's a set of priorities that are important to these folks for probably numerous reasons. And that's how they're achieving them.
Thanks so much for your take, Mary. Any other takes from our speakers? And really, this kind of feeds into another question of what's the Senate's strategy here. We know that the House and the Senate eventually are going to have to align, hopefully within the next few weeks, on their version of the budget. And with such extreme differences, kind of what's the primary want of the Senate? Any takers from the folks on the call? We will come back to it. We'll come back to it, folks. I think really, again, and to Mary's point, yes, just from the budgets that we have before us, from what the House passed and what the Senate has proposed. And again, folks, just remember, we do have another round of changes from the Senate coming early next week. Just from some whisperings I've heard from folks, some of those changes may be more extreme than what we've seen in the sub bill. I wish I was a fly on the wall in some of those conversations with Senate leadership and constructing this budget as to really what their end goal is. If I learn more, happy to share. And folks, quickly, there was a question as well in the chat concerning, and also in the news right now are conversations around Senate Bill 116, which is an overhaul of the Ohio unemployment compensation system, which would severely reduce the number of weeks that Ohioans would receive unemployment benefits. Right now, it's about 26 weeks for folks who, again, lose their job at no fault of their own. The proposed bill would create a sliding scale of qualifying weeks from 12 weeks to 20 as the max, and that would be dependent on the entire state's unemployment rate, kind of economic state. However, we know that throughout different counties, that unemployment rate and kind of that economic outlook can vary greatly. So lots of different conversations happening around the needs of Ohioans about what supports are there for folks who are struggling to get back on their feet, how we can stabilize. Right now, again, there's a lot of different options through unemployment, through different public programs for that help, and they all seem to be under scrutiny and I'll go so far to say attack by the Senate in this version. All right, seeing no other comments from our speakers, I want to thank you so much for your time this morning, and thanks so much, Sarah, for pulling up additional opportunities to connect with us. We are really proud to have so many incredible health and human service advocates around the AOF table, and especially with folks who are here with us this morning. We are also excited. We'll be publicly speaking about some of our concerns on Monday at a press conference in the Senate. We're excited, or in the State House, we're excited to share our thoughts with the broader public on Monday at 10:30. I think we'll have a recording of that available after the fact, but make sure that you follow us on social media. You are subscribed to our newsletter, comes out every Friday. If it calls for it, we may have additional updates and opportunities to engage next week, as this process again is going to speed up very quickly the next few weeks with the finalization of the Senate version, and then of course oncoming conference. So folks, thank you again for being here. Thank you so much to our speakers for your time this morning. We know it's the busiest time yet, but thanks for being here. And we will provide, again, copies of the full recording of our webinar as well as the slides to all who are registered. So if you're on the call with us, you're certainly registered. So you'll get those in your inbox later this afternoon. Thanks again, folks. Stay tuned with us again as this process continues. We appreciate all you do for the people of Ohio and for your advocacy, and we will see you next time. Thanks again, everyone. Enjoy your Friday. Enjoy your weekend.
Thank you.